Robert was 54 years old, not overweight, didn't smoke, walked his dog every morning without fail. 3 weeks before his heart attack, he told his wife he'd been feeling off. Tired in a way sleep didn't fix. A little short of breath on the stairs, a dull ache in his jaw he blamed on a dentist appointment he kept putting off. He didn't know it, but his heart had already started sending him messages. He just didn't know how to read them. Here's the uncomfortable truth. Your heart doesn't fail silently. It warns you first. Sometimes for weeks, sometimes for months. The problem isn't that the signs aren't there, it's that almost nobody teaches you what they actually look like. By the end of this video, you're gonna know exactly what those signs are, including the one that gets missed more than any other, even by people who consider themselves health conscious. And I'm gonna tell you exactly what Robert's third sign was, because it's probably not what you think. Stick around, because sign 3 is the one that fools even doctors when it shows up in the wrong context. Let's be clear about something first. This isn't a video designed to scare you. Fear doesn't help anyone. It just makes people either panic or shut down completely and ignore everything. What actually helps is pattern recognition. Doctors aren't magicians, they're pattern recognizers. And the good news is, you can learn the same patterns they use. The ones that separate probably nothing from get this checked. So here's what we're covering. 5 signs. Real, physical, common signs that show up before serious heart problems. Not obscure symptoms you'll never experience, but everyday things you might be feeling right now and brushing off as just getting older or just stress. And stay until the end, because after sign 5, I'm going to tell you the one thing that ties all of these together. The single question you can ask yourself, right now, today, that tells you whether it's time to act. Let's start with the sign almost everyone has felt, and almost everyone dismisses. Sign 1, fatigue that doesn't make sense. Not the long day at work, tired. Not the didn't sleep well, tired. This is a deeper, heavier kind of exhaustion. The kind where you wake up after 8 full hours and still feel like you ran a marathon in your sleep. Here's why this happens. When your heart isn't pumping as efficiently as it should, whether that's from narrowing arteries or a weakening heart muscle, your body compensates. Blood flow gets prioritized to vital organs, and your muscles, the ones doing everyday tasks like walking to your car or carrying groceries, get shortchanged. Your body feels that shortage as fatigue long before anything shows up on a routine checkup. And here's the part that trips people up. This kind of fatigue is sneaky because it builds slowly. It's not like flipping a switch. It's more like a phone battery that used to last all day and now barely makes it to lunch. And you adjust without even realizing you've adjusted. You just start doing less, taking the elevator instead of the stairs, sitting down halfway through yard work, telling yourself you're just getting older. Sometimes that's exactly what it is, normal aging, but sometimes it's not. And the way to tell the difference isn't guesswork. It's the 4 signs coming next, because heart-related fatigue rarely travels alone. Sign 2, swelling in your ankles, feet, or lower legs. Take a look at your socks tonight when you take them off. If there's a deep, lasting indentation where the elastic sat, that's worth paying attention to. Here's the mechanism. In plain terms, when your heart struggles to pump blood forward efficiently, blood backs up in the veins, and fluid gets pushed out into the surrounding tissue. Gravity pulls that fluid down, which is why it shows up in your ankles and feet first, especially by the end of the day when you've been on your feet or sitting for hours. Most people blame this on being on their feet too long, or too much salt at dinner, or a new pair of shoes. And sometimes that's exactly what it is. But when it happens consistently, day after day, even on days you haven't been particularly active, that's your body telling you something about circulation, and specifically about how well your heart is moving blood through your system. Now, sign 3. Remember Robert from the beginning? This was his sign. And it's the one that fools people the most, because it doesn't feel like a heart problem at all. Sign 3, pain that shows up in your jaw, neck, back, or even your arm, with no obvious cause. Here's why this one is so dangerous to misread. We're conditioned, by movies, by TV, by decades of pop culture, to think a heart problem announces itself with dramatic, crushing chest pain. Someone clutching their chest and collapsing. That does happen. But for a huge number of people, and this is especially true for women, but it happens in men too, The pain doesn't localize to the chest at all. It shows up somewhere else entirely. The reason is actually pretty simple once you understand it. The nerves that carry pain signals from the heart share pathways with nerves from other areas. The jaw, the neck, the upper back, the left arm. Your brain sometimes struggles to pinpoint exactly where the signal is coming from. So the pain gets referred to one of these other locations instead of where the actual problem is. Robert blamed his jaw pain on a dentist visit he'd been putting off. It felt exactly like a bad tooth. Dull, aching, persistent, worse after activity, better at rest. That pattern, pain that gets worse with exertion and eases with rest, is one of the biggest clues that something is being referred from the heart, rather than from a local injury or dental issue. This is the sign that gets missed constantly, in emergency rooms, in doctors' offices, and at home, because it simply doesn't look like what we've been taught a heart problem looks like. Quick gut check before we move on. And I actually want you to answer this one honestly, not just to yourself, but in the comments if you're comfortable. Has climbing a flight of stairs gotten noticeably harder for you in the last 6 months? Not, I'm out of shape harder. Genuinely different than it used to be, because that leads directly into sign 4. Sign 4. Shortness of breath during activity that used to be easy.
This is one of the clearest signals your body gives you, because it's measurable against your own history. You're not comparing yourself to an athlete or to some ideal standard. You're comparing yourself to you, 6 months ago, a year ago. When your heart can't keep up with demand, your lungs and blood can't deliver oxygen to your muscles as efficiently, and your body responds by making you breathe harder and faster to compensate. It's a direct physical consequence of reduced cardiac output. The trap here is the same trap as fatigue. It's gradual. You adjust the goalposts. You stop parking as far away. You take breaks halfway up the stairs and call it being smart. But your own body 6 months ago is the best baseline you have. If today's version of you struggles with something that didn't used to be a struggle, that's not a coincidence to explain away. It's data. Sign 5. A persistent cough or wheezing, especially when lying down. This one surprises people the most because a cough feels like a respiratory problem, not a heart problem. But here's the connection. When the heart isn't pumping efficiently, fluid can build up in and around the lungs, a condition sometimes called pulmonary congestion. That fluid irritates the airways, and your body responds the way it responds to any irritation in the lungs, with a cough. The telltale pattern is this: a cough that's worse when you're lying flat and better when you sit up or prop yourself with extra pillows. People chalk it up to allergies or acid reflux or just a cold that won't go away. Sometimes it is one of those things, but when it's persistent, unexplained, and tied to your body position, it deserves a second look, not a bottle of cough syrup and a shrug. That's all 5. Fatigue, swelling, referred pain, breathlessness, a stubborn cough. But here's the thing nobody tells you, and this is the part I promised you at the beginning.
None of these 5 signs on their own means you're having a heart attack. I want to say that clearly because health content online has a bad habit of turning every symptom into a 5-alarm fire, and that's not responsible, and it's not what this channel is about. A single day of feeling tired doesn't mean anything's wrong. Puffy ankles after a long flight doesn't mean anything's wrong. The pattern is what matters, not any one sign in isolation. Here's the question doctors actually use in some form when they're evaluating a patient. Is this new, and is it persistent? New, meaning it's a change from your normal baseline, not something you've dealt with for years. And persistent, meaning it's shown up more than once, or hasn't gone away on its own after a few days. If a symptom is new and persistent, especially if it's more than one of the 5 we just covered, that's the combination that's worth a real conversation with a doctor. Not a Google spiral at 1 in the morning, an actual appointment with actual blood work, and if needed, an actual EKG. Robert had 3 of these 5 signs, on and off, for almost a month before his heart attack. Fatigue, the jaw pain, and breathlessness on stairs he used to climb without thinking about it. Individually, easy to explain away. Together, they were his heart trying to get his attention. He's okay now, by the way. He made it, and he's one of the lucky ones who got treatment in time. Not everyone is. Before we wrap up, I want to clear up 2 things that trip people up constantly, because I get these questions all the time. Myth 1. I'm too young for this to apply to me. Heart issues are absolutely more common as we age, that's true. But the arteries don't wait for a birthday. The process that leads to heart disease can begin decades before symptoms ever show up. Paying attention to these signs isn't just a getting older habit. The earlier you build it, the better. Myth 2. If it were serious, the pain would be obvious. We already covered why this isn't true. Referred pain, gradual fatigue, symptoms that mimic allergies or indigestion. The body is not always dramatic when something's wrong. Sometimes it whispers instead of shouts. And that whisper is exactly what we've spent this video learning to hear. One more thing worth knowing. Risk factors matter alongside symptoms. Family history, blood pressure, cholesterol, smoking history, activity level. These all shift how seriously you should weigh any one sign. Someone with a family history of heart disease, experiencing 2 of these signs, should act faster than someone with none of those risk factors, experiencing 1. Context matters. That's exactly why this is a conversation for your doctor, not a self-diagnosis from a video. Even this one. Robert told me something after his recovery that stuck with me, and it's the reason I made this video. He said the hardest part wasn't the heart attack itself. It was realizing afterward that his body had been asking for help for weeks, and he just didn't know how to listen. That's really what this comes down to. You don't need a medical degree to listen to your body. You just need to know what you're listening for. And now you do. If you learned even one thing today that you didn't know before, do 2 things for me. First, if any of these 5 signs sounded familiar, don't sit on it. Book the appointment. Not because you should panic, but because 5 minutes of awkward conversation with a doctor is worth more than months of wondering. Second, subscribe because next week I'm covering the symptom. Doctors say gets confused with anxiety more than almost any other, and it's one that sends more people to the ER than you'd expect. You won't want to miss it. Take care of that heart of yours. It's the only one you've got.